Seizure disorders. A seizure is an abnormal electrical activity in the brain's nerve cells. Seizures don't always lead to convulsion. So convulsion is an involuntary spastic contraction of the voluntary muscles. Most commonly, we're more familiar with seizures that include convulsion, but something that you guys have to know is that sometimes seizure can happen without the spastic contraction of voluntary muscles. So seizures can affect the level of consciousness of an individual experiencing it. It can affect the motor activity as well as the sensation. Some causes of seizure include fever, infection, trauma, and sometimes other causes include cancer and vascular causes. So the most common vascular cause is a stroke or cerebrovascular accident or CVA. Epilepsy is a recurrent pattern of seizures. So this is ongoing, not necessarily continuous, but it's basically a more chronic form of seizure disorder. There are different types of seizure, and over time, these categories have changed, but then you will still hear some of the older terms, and that's why I included it here in this lecture. So one of the terms or types of seizure that you may hear about is partial, or also known as focal seizure. So this is a seizure that happens in one area of the brain, and this usually causes short changes in level of consciousness as well as confusion. Generalized onset, or formerly called grand mal seizures, are characterized by neuronal activity that originates simultaneously in the gray matter of both hemispheres. So this happens in both sides of the brain. So there are several subtypes of generalized seizures. Tonic-clonic seizure begin with muscular contraction throughout the body. So this is the tonic phase. Contraction is tonic, and it progresses to alternating contraction and relaxation. So relaxation is the clonic phase, and that's why it's called tonic-clonic. So it starts with a contraction phase followed by an alternating contraction and relaxation phase. Tonic seizures, on the other hand, involve spasms of the upper trunk with flexion of the arm. So this involves contraction of the muscles. And there is also what you call a clonic phase or clonic seizure, wherein it's basically the same thing as tonic-clonic, except it doesn't have a tonic phase. So it's more of a relaxation of the muscles. Absence seizure, on the other hand, involves a brief loss of awareness. Then this commonly occurs with repetitive spasmodic eye blinking for up to 30 seconds. So this type occurs primarily in childhood, so in kids, and it's rare after the age of 14 years old. Focal onset originates again in a localized or focal region. So this is basically the same thing as a partial seizure. So this is originating from a focal area of the brain, so usually in one lobe, and these have different subclassifications or subtypes based on the level of awareness and motor or non-motor involvement of this type of seizures. Unknown onset, so from the term unknown itself, this doesn't clearly fit into any other categories, or the category itself is unknown. So it's really hard to determine where this seizure belongs to. So sometimes it can be a combination of motor and non-motor seizures, but then the description of that seizure does not necessarily fit the other classifications such as the tonic-clonic or clonic or absence and so on. So these types of seizures are referred to as unknown onset. Simple partial or petit mal seizures includes a brief loss of awareness. So it is sometimes referred to as a blank state where the patient just stares without level of consciousness or eye blinking. So it seems like they're just staring blankly and while they're actually having a seizure episode. So this is called petit mal or simple partial seizure. There's also secondary generalized. So from the name itself, secondary generalized, so it starts as a focal seizure, then becomes generalized or grand mal or tonic-clonic. So again, secondary because it starts as a different type of seizure, then becomes generalized afterwards. Unclassified, similarly to the unknown onset, unclassified do not clearly fit into any of the categories. Status epilepticus, so this type of seizure is one of the very important seizures or types of seizures that you have to remember. So this is a medical emergency. status epilepticus is basically multiple seizures occurring with no recovery in between them, which can cause hypotension or low blood pressure. It can also cause hypoxia or prolonged tissue hypoxia, which can lead to brain damage or death. Now, the first line treatment for status epilepticus are benzodiazepine. So the most commonly seen or administered medication in the clinical setting is lorazepam, which is a benzodiazepine. Therapeutic effects of anti-epileptic drugs or anti-seizure medications include the following. They increase seizure threshold. When we say seizure threshold, this is basically a person's likelihood to have a seizure. So the higher the threshold, it means that they are less likely to have a seizure episode. So the higher the threshold, the less likely or less risk for seizure activity. Another therapeutic effect include decreasing in transmission between and within a neuron. So it slows it down, or it prevents that transmission or movement of that electrical activity between a neuron or within that neuron itself. In addition, therapeutic effects include controlling or minimizing seizure activity and basically maintaining the quality of life. Indications of anti-epileptic medications include prevention or control of seizures. In addition, they can also be used for acute and long-term maintenance as well as status epilepticus. Precautions and contraindications. We have to remember for ourselves as nurses, and also we have to educate the patients that anti-seizure medications need to be tapered. So they shouldn't be discontinuing anti-seizure medications abruptly. Let's say a patient is on anti-seizure medication or anti-epileptic just prophylactically or just to prevent them from having seizures. Let's say they've never had seizure before, but if that patient one day decides to just abruptly stop taking anti-seizure medications, even though it's just prophylactic, they can actually end up with seizure episodes. So we have to educate our patient, and we need to be aware that anti-seizure medication shouldn't be abruptly discontinued. Antidepressants. So some antidepressants can actually precipitate seizures, so we have to be very careful when administering these types of drugs together with anti-seizure medications, because then again, this can actually cancel out the effect or interact with the effect of anti-seizure drugs. Anti-epileptic medications or anti-seizure medications have numerous and different side effects, and it will just depend on the drug that we're talking about. So generally speaking, anti-seizure drugs can cause bone marrow suppression, causing thrombocytopenia, and this is likely caused by the drug phenytoin. Anti-seizure drugs can also cause dizziness, and because it affects the neurons, sometimes it can cause some drowsiness. In addition, this may also cause some GI upset and skin issues. Something that you guys have to remember pertaining this drug include the black box warning for suicidal thoughts and behaviors for anti-epileptic drugs. So some medications, some anti-seizure drugs can actually cause suicidal thoughts and behaviors. So we have to monitor our patients closely and really do a thorough assessment on how they're feeling, because again, they are at risk for having suicidal thoughts and behaviors. Nursing actions, assessment of therapeutic effects and side effects, and again, knowledge of the drug level, specific side effects, and the black box warning, depending on what medication we're talking about. And again, I just want to emphasize the importance of tapering these drugs. This medication should not be stopped abruptly because of the risk for having a seizure episode or even a status epilepticus. Patient education, including drug information, compliance, safety issues, and emergency treatment, especially our family members. So we need to educate our family members pertaining status epilepticus, and we need to tell them that this is a medical emergency. Alternative treatments to seizures include keto diet or ketogenic diet. So this is basically a diet that's higher in fat, and at the same time restriction of the caloric intake. So this alters genes involved in energy metabolism in the brain. So for some people this can work, but again, doesn't mean that this works for some people, that this is going to work for everyone else. At this point, once a patient develops seizure, it is always better to maybe try non-pharmacologic treatments if possible, right? If it's effective, then we'd rather do that rather than taking medications. But then again, it doesn't always work for everyone. Examples of drugs under this class include Dilantin or phenytoin, luminal or phenobarbital, Lyrica or pregabalin, Neurontin or gabapentin, Tegretol or carbamazepine. Some things that you have to remember pertaining very specific drugs. So phenytoin or Dilantin, the side effect include bone marrow suppression. It can also cause ataxia and gingival hyperplasia. So this is an overgrowth of the gum tissue around the teeth. So oral care is very important. In addition, this drug can also cause lethargy or decreased level of consciousness. This is one of the drugs wherein you have to monitor for the therapeutic drug levels, and the therapeutic drug levels for phenytoin is 10 to 20 micrograms per ml. I can't remember if I mentioned levetiracetam or Keppra. So levetiracetam or Keppra is one of those very commonly prescribed or ordered medication, especially in the acute care setting. So this is used for both treatment and prevention of seizure activity. As you can see here, luminal or phenobarbital, the therapeutic drug level for this drug is 10 to 40 micrograms per ml. Lyrica or pregabalin and Neurontin or gabapentin, although these medications are used for seizures, these are also medications used for neuropathic pain or nerve pain. So sometimes if you see it in a drug list, it is very important to assess for their past medical history, because again, sometimes this is not taken because of seizure activity, rather this is also taken for pain management, most specifically nerve pain. So although they're both used for nerve pain, you will see that gabapentin is also used often in the presence of diabetic neuropathy. So again, it is very important to ask your patient about their past medical history, because these medications, although they're anti-seizure drugs, sometimes they're used for different indications. Tegretol or carbamazepine, its therapeutic drug level is 4 to 12 micrograms per ml. Carbamazepine or Tegretol is often used for partial or generalized tonic-clonic seizures.